Well, first of all, this disparity among African Americans is very disturbing. It's why I called for the study. You know, nobody was really tracking these things, and it was difficult to do because none of the federal labs, the CDC, nobody was actually tracking these tests by race. And we went back and actually individually looked all this up, thousands of cases, and we are now we've got about 80% of those cases done, and it's why you have the information that you're reporting on. We did it better than any state in America. I also have been successful in convincing the federal administration to consider Baltimore and the entire Baltimore-Washington corridor as a hotspot. We've been taking some of the earliest and most aggressive actions in America, and a lot of our focus has been on those areas that you're talking about. It's where our highest population centers are. It is also where we have the highest concentrations of blacks and Hispanics. And so it's Baltimore City, it's Prince George's County, Montgomery County, right outside of the Washington area, and those counties in between. It's about 5 million people in that corridor. We've had 12 calls now with every single governor in America, 8 of which the president and or vice president was on the call with us. And I can tell you that nearly every single governor, I had a call with the FEMA administrator just yesterday afternoon. Look, I think that we've certainly seen an improvement over the past week from the week before. I know that a lot of people in Washington are working very hard. Everybody has gotten more supplies than we had the week before and the day before. And I know there's people in Washington that are working very hard as partners to try to help the states, but I think to say that everybody's completely happy and that we have everything we need is not quite accurate. I mean, everybody still has tremendous needs on personal protective equipment and ventilators and all of these things that you keep hearing about. Everybody's fighting to find these things all over the nation and all over the world.
And the administration is launching a second economic task force that will focus on reopening large portions of the country. You have said that opening back up is not like flipping a light switch. So do you see it happening in your state May 1st?
Well, we haven't got any kind of an artificial deadline on that. I'm going to look, everybody wants to get the country back on track as quickly as we can, as long as we do it in a safe manner, because we've got this twin problem of this terrible health crisis where we've got, tens of thousands of people dying. And yet we also have this incredible economic challenge where we got, millions of people that are unemployed and small businesses being hurt everywhere. We've got to balance those needs. But really, right now, the first thing is saving lives and keeping people safe. But we do also have to think about how do we eventually ramp up and get some folks back to work. But you can't just pick a date and flip a switch. I don't think it's going to be that simple.